Welcome back to Twin Cities Live. Have you heard the term family estrangement before?
Yes.
I have, but I don't know much about it. It's become more common in the past decade. There can be some shame or embarrassment about this topic as well.
But as people start to share and learn more about it, we're realizing that if you're experiencing this, you're not alone. And Dr. Karin Ryan with Nystrom Associates is here to tell us more about this. Dr. Ryan, we're so happy you're here. I was just listening to a podcast recently with a psychologist who said that family estrangement is becoming more common, that more people are feeling like, if this isn't working with this family member, I'm out.
Yeah.
So what is it actually? Does estrangement mean like, you know, all contact is gone?
Yeah, completely divorced from that person?
Yeah, the definition of estrangement is absolutely to have no contact, so no emotional connection, no physical connection, no interaction with that person. To be estranged means really that distance there and you're not interacting with them in any way.
Well, as we were talking about this in our meeting today, it's like everybody was popping up and going, oh yeah, this person doesn't talk to this person. Or so it really
is common. 1 in 4. 1 in 4 of us are estranged from one of our family members.
Wow.
So why? So okay. So then that's the question: is why? Why is it more common now?
Yeah. Great question. So it can be a slow build, right? So it might be a family where there's been a pattern of conflict or kind of interpersonal dynamics that just really don't serve both people well or one person well. Or it can be a big thing that happens and it can happen more abruptly. So it can happen if there's been abuse in the family, if there's been neglect, if there's been a significant betrayal. Sometimes money issues, between siblings can happen.
Yeah.
If there's different political views or beliefs about gender identity, sexual orientation. So you can see that there are some big rifts that can happen that cause one or the other person, 1 or 2 people to feel like my needs can't be met or I can't be healthy in this relationship. And I think as people learn more about like empowerment and the right to set boundaries, we're seeing more people set boundaries at times.
It's kind of hard for me to wrap my head around it just because you think of family as being such a tight, like we love you through thick and thin, right?
Yes.
And I completely understand that if there's abuse, any nature of abuse, I'm like, okay, fine. That person doesn't need to be in your life. And it's healthy for both parties to just not be in contact. But the like individualized like views politically or whatever, like it's so hard for me to think like, you're dead to me. You don't believe the same thing that I believe in, and we're just done. Like I can't wrap my head around that that's an option.
Yeah, and what you're highlighting, Ben, is that there's different reasons people choose to be estranged from one another, and so sometimes there can be a lack of flexibility or an unwillingness to kind of compromise and meet halfway, and then there are times when it really is healthy to have those clear boundaries where it's like, I have worked for 10 years to try and have a healthy relationship, and every time I'm with this person, it hurts my mental health, it hurts my well-being. I need to have these boundaries here.
So, okay, when you're working with clients, or when therapists in general are working with clients, is the goal to have family reconciliation, or is there a different goal? Like what angle are you coming at this from?
Yeah, the angle is really what the client wants. Right, so we really kind of see the world through our client's eyes, and so what they're working on, what they're identifying, and sometimes they don't know, and so that's really part of what the therapy is what is going to be best for you. And certainly we do family therapy where the members are saying, hey, we want to work on this relationship. We want to have a way where we can interact in a healthy manner. Then absolutely, that's our goal then, right, with them. But there's certainly times when we have had clients where they say, I just really need to not have any interaction with this person. And then it's working through, like you said, Ben, some of that guilt and shame, right? Because it's that I should love unconditionally and I should always be there. And it's this, sometimes it's a balance of, I love this person and I always love this person and want them well, and it's healthy for me to not have any interaction with them. Because every time I do, it's destructive and it makes me feel unsafe and it hurts me.
But then it like rattles the family fabric.
It really
because
can.
It's not just like me saying I don't want to be with you, but then it's you come with all these other people or all these events that someone has to choose.
And some people within the family have alliances to other people. And like, oh no, I understand where you're coming from. I also understand where they're coming from. So they're torn as well.
They are. Yeah, and it can be a really hard position. And so one of the things to think about is if you have 2 family members or family members who are estranged, how do you stay out of the middle? How do you not become that middle person? And so it's having kind of readiness to how do you respond and set boundaries. So it might be, I love you both and I'm not going to get in the middle of it, or, I'm not going to talk with you about him and I'm not going to talk with you about her or them. And so it's setting those clear boundaries. And then sometimes it's not trying to fix it. So it's recognizing that that's theirs and they have to work on fixing that, especially when it's adults. trying to stay out of that balance. But it can be really hard because people want that cohesive and that system, but sometimes, especially like when you're saying when there's been abuse, that person, it's empowering for them to not.
Yeah.
I would suppose it sounds like when families come in together, when the group comes in together, at least both parties, it doesn't need to be the whole family, just the two parties, it seems like that right there is a pretty supportive step that they want to get something figured out.
Exactly.
Like, how much do you, as like maybe a therapist, or like maybe a friend is acting as a therapist, like, do you want to actually bring the other person in, or can things be fixed if just one person comes in the office and says, like, I have this problem with my family member, I need to work through it. Can it work with just one of the two parties?
Yeah, that's a great question, and absolutely. So sometimes it's recognizing, when there's estrangement or significant conflict, it's our own work of like, what am I bringing to this conflict? Where's my accountability? Where can I take responsibility? And so that can absolutely be a great place to start. Sometimes we'll start with like individuals in separate individual therapy and then coming in when they're ready to do family therapy. And so we can really help guide through that. But you're right, sometimes it's that own interpersonal work ourselves of like, not interpersonal, but in my own self, like what can I do to help repair this relationship, and what sort of things are needed to make it feel healthy for both of us.
But I would have to think that, like, for some people on the other side, it's just better if they're not connected, and being okay with that. I mean, I even see this with like adult siblings, especially in like kind of the boomer generation, where they're just like, I'm not doing it with this sibling, and getting to a place where, I don't know, just because someone is your family doesn't necessarily mean that they're your people.
Yeah, and what you're highlighting, Elizabeth, is there really can be a peace and a relief of like, I don't need to do this anymore. Right, and it's, again, that it can really be that balance of like, I love this person, or I care about this person and wish them well, and I don't have to do this. And so it's finding that balance of what is going to bring me the most healing and wellness. And so is that keeping my distance from this person, or is it building and trying to repair?
Family
stuff.
I know. Is there a timeline to all of this when you say, okay, you've been trying at this for 5 years. It's healthy now to walk away. I'm sure that if somebody comes in the first, and they're like, I've had an issue with this person for 6 months. You're like, well, let's pump the brakes here. You know, like how often and how hard should you try before it's like, no, it's okay. You should walk away. So this is healthy.
And estrangement can happen anywhere between like 6 months and you're saying 30 plus 40 years, right? And so I don't know if there's a magic time frame. I think it all depends on how significantly, like, I think the word of like, how harmful is it to you?
Right.
Right. And so it's really taking that, checking in and being like, am I just annoyed and frustrated and not having any tolerance and flexibility, or is this really harming me?
And that's where a therapist can really help too.
Exactly.
To help you kind of get that clarity.
Yeah, exactly.
Oh, Dr. Ryan, thank you
My
so
pleasure.
much.
Thanks
Great
so
to see you. So Nystrom Associates provides care in the fields of psychiatry, psychology, family therapy, and more. We're going to post their contact information on TwinCitiesLive.com.
Let's come back, shall we?
We shall.
We'll be right back.